Diaphragm pacing, which is also called Phrenic pacing, is a method to help improve breathing, speech, and quality of life in certain individuals who use a mechanical ventilator. Diaphragm pacing can potentially relieve dependence on a mechanical ventilator. Join me this week as I discuss how diaphragm pacing works, what happens during the surgery, and who is a candidate for the procedure. In diaphragm pacing, a lightweight, battery-powered system electronically stimulates the diaphragm muscles and nerves. This causes the diaphragm to contract. To understand how diaphragm pacing works, it is important to know how a person breathes. During inhalation, the phrenic nerves stimulate the diaphragm muscles. The diaphragm muscles contract, which pulls down on the chest cavity. This creates a larger space in the chest, which allows air to easily flow from the nose and mouth into the lungs. During exhalation, the diaphragm muscles relax. This causes the chest cavity to decrease in size, which pushes air out of the lungs. Diaphragm pacing involves placing 4 small leads, which are also called electrodes, into either the chest or neck. 2 electrodes are attached to the right phrenic nerve, and 2 electrodes are attached to the left phrenic nerve. A 5th electrode is placed just below the skin, near the other electrodes. All 5 electrodes are connected to a wire holder outside the body. A cable on the other end of the electrode connector plugs into a small device called a stimulator, which is located outside the body. The stimulator sends regular electrical impulses to the electrodes. This causes the diaphragm muscles to contract and mimics a person taking a breath in. When there are no stimuli, the diaphragm muscles relax, which causes exhalation. The pros of diaphragm pacing include reduces or eliminates the time spent using a ventilator or other assistive device, helps a person breathe and speak more naturally, makes activities easier such as dressing and bathing, improves comfort, decreases the risk of respiratory infection, reduces the need for an external power source and concern about power outages. Diaphragm pacing is generally well tolerated. The main risks of diaphragm pacing include injury to the phrenic nerve during surgery, infection of implanted components, and failure of the equipment. Changing positions can compress or increase the distance between the antenna and receiver and may interfere with the diaphragm pacing. During times of respiratory illness, the settings may need to be adjusted or another form of ventilation may need to be used. Obstructive sleep apnea may occur during the night. The diaphragm pacer only stimulates the phrenic nerve. However, there is no contraction of the upper airway skeletal muscles. This can result in the upper airway collapsing and obstructive apnea may occur. Adjustments made to the settings may alleviate this issue. Candidates for diaphragm pacing must meet the following requirements. There must be normal lung function. The phrenic nerves are intact and are able to send a signal when stimulated. The person has relatively mild or no lung disease. Testing can be done to check whether the phrenic nerves and diaphragm work normally. A lung specialist will evaluate the person to see how healthy his lungs are and whether this is an option to consider. Since diaphragm pacing requires fully functioning phrenic nerves and diaphragm muscles, people who have high-level spinal cord injuries are often great candidates for the diaphragm pacer. Also, diaphragm pacing may be a great treatment option for children with congenital central hypoventilation syndrome. The following are conditions which would not make a person a good candidate for diaphragm pacing. Patients who have active lung disease, heart disease, or brain disease, patients with a significant chest deformity such as scoliosis, patients with a neuromuscular disease, patients who are overweight. A special note about obesity. In very obese people, there may be too much fat tissue between the antenna and receiver, which can limit getting a good signal to the phrenic nerves. With obesity, it may not be possible to find a consistent diaphragm pacer setting needed to achieve adequate ventilation. There has been a big debate over using diaphragm pacing in people who have ALS. Some physicians claim diaphragm pacing can be used in ALS patients, while research studies have shown that early intervention with diaphragm pacing did not delay the need for non-invasive ventilation and actually shortened an ALS patient's life by 2 months. Large research studies using diaphragm pacing in ALS patients have been tried. However, the studies were halted due to the disastrous results. The takeaway: there are some doctors who claim diaphragm pacing works in ALS patients. However, no large research study has been able to substantiate this claim and has shown diaphragm pacing can cause great harm to ALS patients. To place a diaphragm pacer requires the skill of a highly trained surgeon. This surgery will require general anesthesia and usually 1 to 2 days in the hospital. After surgery, the diaphragm pacer is not used right away. It is best to wait for the incisions to heal and for scar tissue to form around the nerve electrodes to stabilize them. Diaphragm pacing is generally started 6 to 8 weeks after surgery. Pacing is only done for 1 to 1.5 hours before the diaphragm becomes fatigued. The diaphragm pacer is then switched off. The time on the pacer is gradually increased. Since the pacer stimulates the diaphragm in a different way than how the phrenic nerve naturally sends nerve impulses, it takes some time for the body to get used to this. After 3 months, the pacing is usually up to about 8 to 12 hours. Some physicians believe this is the maximum a person should use the diaphragm pacer. However, other medical professionals believe after about a year of continued training, a person can use the diaphragm pacer for 24 hours a day. Since I have mitochondrial disease, which affects my muscles, diaphragm pacing would not be a good option for me. I need a tracheostomy tube and ventilator because my diaphragm muscles are very weak. Diaphragm pacing would only stimulate my fatigued diaphragm muscles and would most likely cause my diaphragm muscles to burn out. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye! Testing can be done to check whether the phrenic nerves and diaphragm work normally. A lung specialist will evaluate the person to see how healthy his oh. Oh, this is really funny. I write my script and I didn't write this properly. I put a lung specialist will evaluate the person to see how healthy his legs are and whether this is an option to consider diaphragm pacing. I don't know what your legs have anything to do with breathing. Oh, I meant to put lungs. Oh, it's too funny, too funny. No, you don't need your legs tested, just your lungs. Okay, back to filming.